211 Chak Sadikabad. The married for 12 years, para 4 miscarriage, 1 previous 4 cesarean section plus bilateral tubal ligation. Last childbirth 3 years back. Admitted on 28th December 2020 in Sheikh Zayed Hospital, Rahimia Khan, through outpatient and department, and presented with complaints of irregular vaginal bleeding from 6 months and continued vaginal bleeding from 15 days. According to my patient, she was having regular menstrual cycle, 5 by 28 with average flow. She used to soak 2 to 3 homemade pads, like the uh, homemade pads. There is no history of dysmenorrhea, dyspareunia, intermenstrual bleeding, postcoital bleeding. From last 6 months, she is having no specific pattern, and she used to bleed it on and off of and she used to soak 5 to 6 homemade pads with passage of heavy clots. There is a history of clotting, and she used to change 2 pads per night. There there was no history of dysmenorrhea and dyspareunia and postcoital bleeding and vaginal discharge. There is no history of preceding amenorrhea, uh, some feeling of mass in lower abdomen or some mass coming out of vagina. There is no history of easy visibility and bleeding from any other side of the body. No history of any drug intake. Like, there is no history of heat and cold intolerance, as weight gain or loss, or evening rise of temperature with chronic cough and yellow discoloration of uh, eye and skin. There is no issue of hot flushes and mood swings and irritability. Uh, uh, Patient has a history of generalized weakness and easy fatigability, but no history of shortness of breath. She can do her household work easily. Her diet is sufficient to eat meat and milk and green leafy vegetables. As no history of pica and worm infestations, cola drink and in excessive intake of tea. She used to take hematinics on and off. For this complaint of bleeding, she consulted 2 to 3 times in nearby clinic for the complaint of bleeding, where her ultrasound has been performed and certain medicine has been prescribed to her. With these medicine, her bleeding was settled, but she is not known of settled for a few days, and then again, and when she stopped to take bleeding, then again bleeding started. And with these complaints, now she came here in Sheikh Zayed Hospital. Here her certain investigations has been carried out and ultrasound has been performed, and no further plan of management has been discussed with her. She Minak at the age of 13 years, with regular menstrual cycle and average flow, she used to soak 2 to 3 homemade pads. There was no history of dysmenorrhea, dysmenorrhea, intermenstrual bleeding, and postpartum bleeding. For pap smear never taken. She is para 7, and her all pregnancies were a book pregnancy, and all babies are delivered by cesarean section. There was no antepartum, intrapartum, and postpartum complication. All babies were of average weight, breastfed, and vaccinated. There is no history of hypertension, diabetes, chronic liver disease, renal disease, asthma, and tuberculosis. Is no significant any surgical history except cesarean section and bilateral tubal ligation. And there is no family history of diabetes, hypertension, chronic renal disease, liver disease, fibroid. There is no history of breast endometrium, uterine and colon carcinoma in the family. She is non-addict and non-smoker. She is having regular sleep and a bowel habit, bowel and urinary habits. It's She lives her own house, and her husband is a farmer. Her basic necessities of life are met with very difficulty. 35-year age, 35-year of old female sitting comfortably on the bed, well oriented of time, place, and person, and her weight is 60 kg and height is 154 centimeter, making her BMI 26 kg per meter square. Her blood pressure is 128 millimeter of mercury. Temperature is 98.6 Fahrenheit. Respiratory rate 14 per minute, and pulse is 86 x per minute. She is a pillar. There is no polynechia clubbing jaundice. Thyroid is not enlarged. No palpable. Uh, Thyroid is not enlarged. All palpable lymph node, all accessible lymph nodes are not palpable. Oral dental hygiene is satisfactory. Bilateral breast examination revealed no abnormality, and both breasts are asymmetrical, and no lump is palpable in either four quadrant of both breasts. On chest exam, uh, regarding her cardiovascular system, first and second heart sounds are audible with no added sound, and on chest examination, normal vesicular breathing with no added sound. On abdominal examination, abdomen is protuberant with centrally located umbilicus moving with respiration, and there is a scar mark of a lower transverse incision with no prominent pulsation or pulsation, and or vein seen, and hernial orifices are intact. Abdomen is soft and not tender, and no palpable viscera. On pelvic examination, on inspection, vulva is normal looking with normal hair distribution. And on a speculum examination, cervix is normal looking, and bleeding is coming out of the cervix. And visible vaginal walls are normal looking. Pap smear is taken for the demonstration purpose, as a demonstration purpose, and that is a fixed and dry. On bimanual examination, an anteverted uterus, 8-week size, mobile, non-tender, and all phoneses are clear.
Investigation.
Madam, I need certain investigation in which I need blood group and RH factor.
Blood group A negative.
Complete blood count in which I need hemoglobin.
Hemoglobin 7 gram per deciliter. TLC platelets normal.
Madam, I need peripheral picture and RBCs indices.
All
In
indices are
RBCs I हाँ जी MCV, MCH और MCHC. MCV, MCH और MCHC.
all indices are decreased.
I need random blood sugar.
140.
I need urine complete examination in which I need microscopy and biochemistry. Microscopy I need pus cells, and biochemistry I need sugar and protein.
1 to 2%, glucose nil, protein 3 plus.
I need hepatitis B surface antigen and anti-hepatitis C antibody.
Negative.
I need transvaginal examination, transvaginal ultrasound.
We'll discuss later. Summarize.
Old, para 4, miscarriage 1, previous 4 cesarean section. and presented with irregular vaginal bleeding and continue vaginal bleeding from 15 days with low hemoglobin in 7 gram per deciliter. She is pale. And on examination, vulva is normal looking. And on speculum examination, cervix is normal looking but with bleeding. And bimanual examination and anteverted uterus, 8 week size, mobile, and non-tender, and all cornices are clear.
What is your differential diagnosis?
On the basis of history and examination, my first differential diagnosis is the fibroid uterus, and
Why
and
fibroid
my
uterus?
second uh, जी डॉक्टर शाजिया.
Why fibroid uterus?
My first differential because my patient is having heavy vaginal bleeding, and her uterine size is of 8 week. Uh,
Okay, any other differential?
my second differential is endometrial pathology that can be benign or malignant. And my third differential is there is hormonal imbalance.
Okay, how will you manage her?
And fourth diagnosis is adenomyosis. Before managing my patient, madam, I need uh, ultrasound report in which I need uterine size, and myometrial echogenicity, endometrial thickness, and any adnexal pathology. Or if there is any uterine mass, so then there is number of masses or site of masses, whether they are distorting cavity or not. आवाज नहीं आ रही
Ultrasound
है आप.
uterus is normal size, 8 into 7 centimeter. Endometrial thickness also normal, and no myometrial pathology.
ये शुरू. Yeah,
Okay,
as my
okay.
patient is para 4 or para 4 previous 4 cesarean section and last childbirth 3 years back, and she is complaining of, she is having complaint of irregular vaginal bleeding from 6 months and continue vaginal bleeding from 15 days, and she is anemic, and I will counsel her to I will counsel her to take oral medicine, in which I will start her with non-hormonal treatment. First of all, I will give her transamic acid, 500 mg twice a day,
Will
and
you do her
also,
endometrial biopsy or not?
ma'am, my patient is uh, uh, only 35 years old, and
Then is 35-year a contraindication to endometrial biopsy?
मैम एंडोमेट्रियल थिकनेस भी उसकी नॉर्मल है और वो 35 इयर्स ओल्ड है. उसने जो पहले ट्रीटमेंट ली है वो भी
Which
उसको पता नहीं है
endometrial thickness is indication for her endometrial biopsy?
एंडोमेट्रियल बायोप्सी. मैम प्री मेनोपॉजल में व्हेन एंडोमेट्रियल थिकनेस इज ग्रेटर देन इन 14 mm.
Where it's written? You
नॉर्मल
need to search and send me reference for this. And what are other indications for endometrial biopsy in reproductive age?
इन रिप्रोडक्टिव एज, अगर उसको 3 months उसने मेडिकल ट्रीटमेंट ली है और इट फेल्स, वो हो चुकी है उसको, और फिर उसके रिस्क फैक्टर्स हैं फॉर एंडोमेट्रियल सीए, और कोई जो है वो टेमोक्सिफिन, अगर वो सी ब्रेस्ट के लिए टेमोक्सिफिन ले रही है तो फिर उसके बाद एंडोमेट्रियल बायोप्सी करनी है उसकी।
एनी अदर इंडिकेशन?
अगर उसको कंटिन्यू एबनॉर्मल यूट्राइन ब्लीडिंग है उस वक्त, सिम्टोमेटिक एबनॉर्मल यूट्राइन ब्लीडिंग।
एनी अदर इंडिकेशन?
बिफोर अब्लेशन और वो
और
Is irregular vaginal bleeding not an indication for her endometrial biopsy? Focal lesion. Is your
तो
patient having symptomatic
एंडोमेट्रियल थिकनेस तो
abnormal uterine bleeding
नॉर्मल
or
आई है, तो मैंने फिर भी
asymptomatic?
उसकी बायोप्सी करनी है। एंडोमेट्रियल थिकनेस तो उसकी नॉर्मल आई है, फिर भी एंडोमेट्रियल मैंने बायोप्सी करनी है डॉक्टर शाजिया।
In reproductive age, there is no significance of endometrial thickness, and indications of endometrial biopsy in reproductive age are if your patient is less than 40 years, then if she is having PCOS, she is obese, she is having any family history of endometrial malignancy, she has failed medical treatment, irregular vaginal bleeding, any focal lesion. All
तो
these are
डॉक्टर
indications
शाजिया
for
इसका बीएमआई
endometrial
भी डॉक्टर
biopsy,
आसिया डॉक्टर
irrespective of
शाजिया
endometrial
इसका
thickness.
बीएमआई भी 26 है डॉक्टर शाजिया। इस पेशेंट का बीएमआई भी 26 केजी पर मीटर स्क्वायर है, उसकी फैमिली हिस्ट्री भी नहीं है, उसने पहले कोई ट्रीटमेंट भी ली हुई इस लास्ट 6 मंथ में उसको नहीं पता, वो 6-7 डेज के लिए वो ट्रीटमेंट लेती रही है और उसके बाद वो छोड़
But
देती
she
रही है
is
और उसकी
having
ब्लीडिंग दोबारा
irregular
स्टार्ट हो
vaginal bleeding, and irregular vaginal bleeding is an indication for endometrial biopsy. Have you gone through guideline of heavy menstrual bleeding? Updated guideline of heavy abnormal uterine bleeding.
डॉक्टर शाजिया मैं आपको दोबारा ज्वाइन।
जी डॉक्टर हिना।
जी डॉक्टर शाजिया, मैं इस पे नहीं, इरेगुलर वेजाइनल ब्लीडिंग 6 मंथ उसकी कोई ट्रीटमेंट भी नहीं ली, उसकी एंडोमेट्रियल थिकनेस भी सही है, मेरी पेशेंट की प्रीवियसली साइकिल भी रेगुलर था, उसकी पीसीओ की भी हिस्ट्री नहीं है, पेशेंट ओबीस भी नहीं है, तो फिर डॉक्टर शाजिया मैं उसकी एंडोमेट्रियल बायोप्सी डायरेक्ट क्यों करूं?
Okay, you need to reconfirm indications of endometrial biopsy from a heavy menstrual bleeding guideline. I have already shared PDF and I will reshare.
नहीं मैंने डॉक्टर शाजिया मैंने एचएमबी की जो है वो मैंने गाइडलाइंस पढ़ी हुई हैं
उसमें
ठीक है। देन I will counsel the patient as is that as she is having irregular vaginal bleeding, and so I will plan for her endometrial biopsy as a outpatient department, and will take her endometrial biopsy by the pipel, and after sending the endometrial biopsy, then I will start a non-hormonal and hormonal treatment. Hello? Hello?
What is gold standard treatment for endometrial biopsy? डॉक्टर होना हिना, ये आपके ग्रुप के डॉक्यूमेंट्स में है, 2 Figo systems for normal and abnormal uterine bleeding systems and classification of causes of abnormal uterine bleeding. ये आपने आज बैठ के पढ़ना है।
ठीक है रक्षा से
ये अभी आए हैं और ये सब लोगों को पता है, और इसके मुताबिक आपकी जो है, और ये गाइडलाइन भी अपडेट हो गई है हैवी मेंस्ट्रुअल ब्लीडिंग की, उसके मुताबिक अब गोल्ड स्टैंडर्ड आपकी स्टिल है हिस्टोस्कोपिक गाइडेड एंडोमेट्रियल बायोप्सी।
शाजिया ये आपने हमें नहीं शेयर की हुई, ये वाली नहीं है हमारे वाले ग्रुप में, नहीं आपने शेयर
फॉरवर्ड। और ये एचएमबी की भी मैंने की थी शायद पहले, अभी मिल नहीं रही मुझे।
जी एचएमबी की तो आपने की थी, वो जो 2019 में आई हुई है वो मैंने पढ़ी भी है, उस
वो
हाँ
आप
जी,
मुझे रीशेयर कर दें, फिर मुझसे मिसप्लेस हो गई
मैं
है। ये
आपको
फीगो
शेयर
का
कर
मैंने
देती
आपको भेज दिया है।
हूँ, फिगो का आप मुझे भेज दें। हाँ जी, फिगो की कर दी है। अच्छा, अब इसको पढ़ो।
अब क्या डिसाइड हुआ, आप इसकी बायोप्सी बनती है या नहीं बनती?
जी, बायोप्सी बनती है।
ओके, तो पहले क्यों नहीं सोचा?
मैंने इसलिए नहीं सोचा कि मैंने रेगुलर, खुद ही उसका पैटर्न भी स्पेसिफिक नहीं है, सारा कुछ वो नहीं है, तो इस बारे में मैंने नहीं सोचा। और मैंने ये सोचा कि मैं इसको हार्मोनल नॉन हार्मोनल इसका एनीमिया ट्रीट करके उसके बाद 3 मंथ ट्रीटमेंट दे के उसके बाद इसकी एंडोमेट्रियल अगर फेल हो जाती है तो एंडोमेट्रियल बायोप्सी करूंगी। मैंने ऐसे सोचा था इसका प्लान ऑफ मैनेजमेंट।
इरेगुलर
लेकिन
ब्लीडिंग
पहले
में एंडोमेट्रियल बायोप्सी करते हैं इवन इफ 40 इयर्स ऑफ एज, लेस देन
इवन जी
40 इयर्स।
एंडोमेट्रियल बायोप्सी करके और फिर उसके बाद इसकी ट्रीटमेंट शुरू कर दें, इसके ब्लीडिंग की ट्रीटमेंट भी
इसलिए
और
कि
फिर
जो
एनीमिया की
एंडोमेट्रियल
ट्रीटमेंट।
कार्सिनोमा है, इसकी पीक एजेस कौन सी हैं?
पीकेजीज जो है वो 45 to 50 ईयर्स तक है।
हम्म, बट
थर्टी
लेस
फाइव
देन
ईयर्स तो
40
नहीं है
इसका
उसकी।
हो सकता है पर इंसिडेंट, व्हाट इज इंसिडेंस ऑफ
लेकिन वो
एंडोमेट्रियल
तो
कार्सिनोमा?
1 in 10,000 है वो, डॉक्टर शाजिया।
ऑल्दो
वन
रेयर
इन
है
टेन
बट हो तो
थाउजेंड है।
सकता है।
जी जी, बिल्कुल हो
और
सकता है।
हाइपरप्लेजिया भी हो सकता है। दैट्स व्हाई वी
जी,
हैव
हाइपरप्लेज
गाइडलाइंस फॉर हाइपरप्लेजिया इन फर्टिलिटी रिक्वायरिंग पेशेंट्स।
जी, हाइपरप्लेजिया भी हो सकता है।
और अगर हम लेस देन 40 पे किसी की बायोप्सी ही नहीं करेंगे, हाउ विल वी डायग्नोज हाइपरप्लेजिया? ओके, मैनेज है।
ठीक है। आई विल I will counsel the patient that as she is having irregular vaginal bleeding from 6 months, for this it is necessary we will take her endometrial biopsy. I will take her endometrial biopsy as outpatient. I will take her endometrial biopsy by the PEPL, and after this I will treat her bleeding in problem. I will start her with non-hormonal. First of all, I will start her with non-hormonal treatment and give tablet mefenamic acid 500 mg thrice a day for 7 days, and also I will start with the low oral progesterones. I will give her nor tablet norethosтерone 5 mg thrice a day for 21 days, and also start her therapeutic doses of uh, uh, tablet ferrous sulfate 120 to 40 milligram per deciliter twice a day with a glass of water, and give her dietary advice to take uh, give her dietary advice to take green leafy vegetables and meat, and empirically deworm her by tablet mebendazole 100 mg twice a day, and tell her to take medicine compliance, and counsel her to revisit after 10 days with a report of histopathology. Hello.
If histopathology shows endometrial hyperplasia,
Uh, uh, then I want to know about the type of endometrial hyperplasia. It is a simple hyperplasia or hyperplasia with atypia.
hyperplasia with atypia.
uh, with atypia. Then I will again counsel my patient that it is a pre-invasive condition and of endometrial CA, and pre-invasive condition of endometrial CA. I will counsel them that the definitive treatment of endometrial hyperplasia with atypia is the total abdominal hysterectomy plus bilateral self-injectomy. And I will counsel counsel her about the uh, mm, counsel her about the procedure. I will counsel her about the procedure and a need of hospital stay, uh, and a complication related with this procedure. uh, with this procedure, I will build optimize the patient, and build up her anemia, and during the um, I
Will
will
you do
also
her
counsel her
oophorectomy
about
or
the
not?
no, madam. I will, before the procedure, I will counsel the patient that the operectomy depend upon the intraoperative findings, and as the if the health ovaries are normal looking, and as the patient has the no family history of CA malignancy, or then after intraoperative findings, and she's at 35 years of age, then I will plan there is need of oophorectomy or not.
Can't you offer her Myrina?
Mm. No, no, madam. In endometrial hyperplasia with atypia, Marina is only offered when there is fertility preserving. But the family of my patient is completed, and she's already have self-injectomy. So I will offer her a total abdominal hysterectomy.
Okay. How will you follow her up?
Then now I will I will counsel her and optimize her hemoglobin, and then after taking
Now, how
after
will you
her
optimize her hemoglobin?
optimize her for the preparation of total abdominal hysterectomy. I will transfuse her pack cell volume. um, uh, uh, Hanji, I will transfuse her Paxil 3 units of Paxil volume, and then I will take anesthesia fitness, complete her labs, and then prepare her for total abdominal hysterectomy.
Okay. What can be complications of hysterectomy?
Uh, a complication associated with the hysterectomy are with the general anesthesia complication that are cardiac or pulmonary. Cardiac arrest can be happen, and um, pulmonary edema can be occur, and complication associated with the surgery, intraoperative findings which include the hemorrhage first of all, and then damage to the adjacent viscera, like
Can you do her vaginal hysterectomy or laparoscopic hysterectomy?
no, ma'am, I can't do her vaginal hysterectomy uh, uh, because she's having
Why?
previous 4 surgeries. Or also, I will refer her to the patient to other expertise, because I'm not expert in vaginal hysterectomy.
Can she be offered a vaginal hysterectomy or not? If
No,
expertise
ma'am,
and facilities
because
are available.
she, ma'am, she has previous surgeries, previous
But
four
then why
cesarean.
you referred her to other person for vaginal hysterectomy?
If you are seeing to, if offered, I will not offer her. If I will not offer her a vaginal
क्यों
hysterectomy.
नहीं बताया कि she is previous for and most importantly she is